6 million Americans annually seek medical help for dizziness. Most are elderly, and their number one fear is falling.
I fell a couple of times, particularly at night, getting out of the bed, and you might experience the same thing. You throw your legs over the bed and you get up to walk, and you do it too quickly at night, and your vision is not there, your sense of balance is not there. And I fell twice at night, and I said, whoa, you know, this is not right. And then I was working outside in my garage one day, and I whirled around to pick up something, and there again, not giving my senses time to develop, I fell flat on my face. So, you know, my balance was really leaving me then. So that, you know, go to the doctor.
One day I was driving down the road and it happened. So I had to stop because I could not see or tell where I was going, driving the car.
Everything starts going over and over, and it goes really fast. And when I get up, I have some dizziness.
I started falling, I fell about 3 or 4 times in about a week. So went to the doctor, and he checked me all out and said I had Parkinson's.
How can you help them? As a doctor, you may have already experienced the frustration of trying to answer that question. Quite often, diagnostic workups provide low yield, and long-term vestibular suppressant therapy such as meclizine can prolong the disability, and in some cases, even worsen the situation. As a result, recovery is at best incomplete, and the patient still remains at risk for falls.
Many times, patients are treated only symptomatically, and that is to say primarily with medication. Those being medications that have traditionally been labeled as being efficacious or desirable or useful in the treatment of dizziness. However, many of those medications actually are extremely sedating, and therefore it is not in the best interest of the individual to put someone on some kind of medication that would create sedation or sleepiness, which actually prevents the patient from recovering from their overall balance problem and complicates the treatment of such disorders.
Many primary care physicians are still telling patients that either they need to go on these vestibulo-suppressing medications, which in some cases are more than inappropriate, they're harmful, and also to just go home and learn to live with it. You know, if the patient tells the physician, well, I get dizzy when I move too fast, physician says, well, then don't move so fast. Well, that's fine, but it's still not coping with the problem.
Now, thanks to MedTrack, there is a comprehensive outcome-based program that offers both diagnostic and treatment-based plans you can provide to your patients, which are non-invasive, easy to perform, and can be operated and managed by your existing staff.
In order to look at therapy, you just can't apply a broad spectrum therapy to every patient. In conjunction with our video diagnostic equipment, we're able to determine the etiology or the cause of the balance and dizziness problem, and then we have designed programs and protocols specifically for each of those disorders. An example would be during an evaluation we may find that a patient has some type of central vestibular deficit in the brain, and they may be an older patient in their 70s or 80s. And we would then design a program specifically for the brain-related type of disorder that we've found. Rather than putting them on a treadmill and having them do a lot of walking and a lot of other types of non-evasive type therapy, we actually focus on the disorder itself and where it is, and those therapies are designed for each specific disorder.
Best of all, the MedTrack programs provide incredible results and will help return balance back to the lives of your patients and benefit your practice. No longer will you lose potential income in patient management due to unnecessary referrals outside of your practice.